was the founder of New Community Corporation. Founded New Community in conjunction with other citizens of this community. For those who might remember the 1968 riot when they destroyed so many things in our neighborhood and actually brought the community down. Mothers were sleeping with their babies on the streets. Mice, they have no place to prepare hot meals for their children. And a young Christian, a white man, Monsignor William Williams, together with some community members, gathered and said, we can't let this happen in our community. We have to do something. So they started building, you see how many houses? Which is what we have for families. I'm not going to bore you with everything we community have. I'm only going to mention what a few so that you understand that New Community is built to accommodate everything that we need to make our lives better as human beings. So we have banks, the credit unions, we have family services bureau that help us with addiction and other things which supervisor is here. And we give our audience to get up and take a little bit of what we do. We have the child care centers, so many of them. We have this building, which is like extended care. And I'm going to focus more on this building because you're here, because I'm sure when you came to New Community, you must have done orientation and tell you all the services of New Community. So I'm not going to go into it, I promise. I'll focus mostly on what happens here. In this very building, how did we start? Our seniors then, after they had the senior buildings and what have you, they met with Monsignor William Binder and then all the people that were in charge of the New Community. And they said, when we get sick, they throw us uphill where our people cannot come because we don't have cars to drive us down there. We want our own nursing home where if anything is happening to us, we can go there so that our people can also visit our friends and well-wishers. You see there's a bus stop right here, right? You take it, there's a bus stop here, there's a bus stop over there, and there's another one over there. So people have means to get here without a problem. Because our seniors, when the weather is good, they actually stroll down from the senior buildings and make their way down there, those who can, and visit the residents that are here in the nursing home. So they talked to Monsignor there, and in 1983, they constructed this nursing home, and we received our first patients in 1984. That's how this place came to be in operation. Now the question is, what do we do? What is it? Many a time people hear nursing home, they say, oh my God, that's the place to go there. Put you out until you die. That's what people think it is. That is really not very true. Because this is a long-term care facility, yes, it is a nursing home. But also, it is a skilled nursing home. What does that mean? You can come and get your therapy. Let's say something happens. I mean, we all know we get high blood pressures, we get diabetes, we get heart conditions, we have all kinds of illnesses, and we do get sick. And when we get sick, we go to the hospital. Many a time, even if you have surgery, they're not going to keep you in the hospital forever. You know that. They will give you some days, and you have to go to a rehab place. This place is also a rehab place because we have our in-house physical therapy department that will evaluate the person, give you your therapy, and we have had a lot of successful stories. In fact, one of my favorite one was a resident that was 107 years old. She broke her hip. She fell at home and broke her hip. The family brought her here. When she went to see the doctor, within 2 weeks, the doctor could not believe what he was doing. She was working with her work. Isn't that a miracle? It is a miracle. Because she was able to get back up and wake them. Back to my body. Thank God it's because of the care she got. She was able to do that. We've had a lot of our young people, our middle-aged people, and our older residents who actually came here and they got their rehab, their treatment, and they went back to live back in the community. That's the goal. As much as possible, get people physically fit so that they can function within their capacity back in their apartment. And we do that a lot here. We work with the social workers that work in the buildings where people live, so that if you go to the hospital and you need, because what are the reasons why somebody might go to the hospital? They might be to continue IV antibiotics or intravenous hydrations, because they can't keep you in the hospital and continue to give you that. If you are to be on antibiotics maybe for the next 2 or 3 or 4 weeks or 6 weeks, because it depends on what the condition is, then you need to move to a nursing home or a rehab place, that's what it's called, so that they can continue, the nurses will give you 24-hour care and give you that antibiotics and monitor you. Then at the end of it all, you receive your therapy, you feel stronger, then you are discharged back into your apartment. And we work with the social workers to make sure that your apartment is still full when you come for your rehabilitation. And once you get well, you go back to your apartment, no problem. Does it mean that everybody that comes must go back? We know that's not reality. There are people that might not be able to manage on their own anymore because we all age. Certain illnesses we might not be able to. Let's say somebody had a stroke that they are really paralyzed on both hands and legs. No matter what you do, it's hard for that person to live alone. Isn't that true? And if the person don't have somebody that will live with them in the house, because there is a time in your life you will need 24-hour nursing care. And we know families work. Everybody has a bill to pay. We all know that. If your family is working, how are they going to be able to take care of you? It's not possible. And you need somebody to take care of you for that 24-hour care. When it gets to that situation, or somebody has dementia, we've all heard about dementia, right? The person gets confused. Many a time they try to cook in the stove. Or they put something on the fire. I'm sure if you live in the senior buildings, you've seen the smoke all the time go off. Fire alarm is going off. It's not because the person wants to run down the building. It's because they have forgotten that they have something to do with the fire. And in that case, that person has become a danger to themselves and to everybody that lives in the building. That kind of a person cannot live alone anymore. In that case, that person can come to the nursing home with us, and we will take care of that person, and that person lives with us. So those are some of the examples that will make somebody come to the nursing home and then you stay until when God says it's time to come. Am I making sense? So many a time when people hear, oh, nursing home is the place to go, once you go there, the love is go, that's the end of it. It's not true all the time. There are people that come for a short term and they go. And there are people that will come and they have to stay because they can no longer take care of themselves and there is nobody in the house to care for them 24/7. Now, what are some of the things we do here for our seniors? In In this facility, we have, like I said, rehab department. In the rehab department, we have physical therapists, speech therapists, occupational therapists. What do they do? The physical therapists, when people have stroke, people have been very ill. You know the muscles, if you don't use them, they become very weak. If somebody has stroke, you have to retrain the muscles again and reteach it how to move. But all that can work when the brain is working. Am I making sense? Because the brain has to work in order to coordinate. I can teach you everything. If your brain cannot retain it, it's not going to work. Okay? So again, that's where we need to pay attention that level of understanding up here is very important. Because you can put somebody in therapy, but if that person cannot, the brain is not working to coordinate, it's not going to work. So you know that person eventually is going to lose all the skills and wind up being somebody who have to take care of for self. Speech helps with talking. When somebody has stroke, they lose the ability to speak anytime. They also have problems with swallowing because all those muscles are paralyzed and involved. So they need somebody that will retrain to start learning how to speak again and learning how to swallow. Because when you can't swallow properly, it's a problem. The person can choke and die. So they come to a place like this, the nurses, with the help of rehab department, will try as much as possible to rehabilitate the person because it's important. Our goal is for everybody to eat by mouth. You want to taste the food that you are eating, right? So we do everything within our power to help that person to get back to it so that they can taste food and enjoy it as we all do. Now, are there cases where the person will not be able to swallow anymore? Yes, that will happen too. Remember I told you, everything you're doing has to coordinate with the brain. Some people have issues where the brain is no longer coordinated, and those are the ones that wind up with chew, where we now have to feed them chewing too. We do that too. Am I making sense here? If I say anything you don't understand, please stop me. I'll go back and take you back to what I said. Occupational therapy. They help you to learn how to use your motor skills, your hands again, right? You know you want to cook. You should be able to put that food in the microwave or put that food on the stove. It requires this coordination to put it, pick up things. Those little things. The occupational therapist help you to get used to using your hands again on how to do it. Now we also provide, because we know the world we are in today. A lot of our people have mental issues. We have drug issues. Is there anybody in this room that doesn't know somebody who has drug issues? Anybody? I think we all do, right? We all do. No, I think we have drug issues. We also know that there are mental issues going on in our community. Before, they used to put people with mental illness in a special hospitals. But we all know they closed most of those hospitals. Look at what is happening in New York. Majority of the people committing crime are really people who should have been in a psychiatric setting. But they let them go, they mix up with the community, and that is a problem. Okay? So yes, we do have people who have some mental issues, some drug issues. But again, that's where we work together with our family services bureau across the way. And we can help that person with counseling, drug and alcohol issues. And by the way, you don't have to be here to get those help. You can also reach out with the social workers because they have resources right here in the community. And they can help you. But when it comes to you, the person being here, we work with methadone healers where we help them to try to get them to stop using drugs. We work with that. And that's what we ask our community. Because people are here, we pay attention so that we stop people from bringing it into them from the outside. Yes, we have to do everything to make sure that that person is safe in-house. And that there's no drug issue, no alcohol issue going on inside the building. So we have psychiatrists that come and see the people, prescribe have those kind of things. And of course, in-house, we have medical doctors. Some of you know Dr. Retired, some of you know Dr. Patel, some of you know Dr. Schubert, some of you know
Bonigo.
Dr. Banigo. They all come here. And of course, we work with Optum Services, which is, they have contract with United Health. And we have assigned nurse practitioner. She's actually at the back. Her name is Anne-Marie. She'll be coming back out here to tell you guys a little bit about their services. So she is here every day. Optum has a nurse practitioner in-house that get to see every patient of theirs in this building and check them, and the goal is to prevent people from getting sick so that they don't wind up in the hospital. You know, when you wind up in the hospital, it's not the disease that takes you there that you're coming out with many a time. And sometimes it's not even the disease you went in there that is going to kill you. They'll put you in a room with somebody who has another illness, and eventually, what happens to people? They contract that disease. This is the truth. So our goal in New Community Extended Care is to do everything within our power to prevent our residents from ending up in the hospital. Because when they go, they don't come back with what they went with. They come back with more things we don't want. Pressure ulcers, weight loss. So the care that the residents get here is provided by multi-system. We have our activity department. You know, we got to keep the body and the soul together, right? The fact that somebody is sick or in the nursing home, does it take away who they are as a human being? No. My residents in this building, they're fighting more than me and you out there. Put the music on and you see what is coming down. They're not playing. They still rock it the way they used to rock it out there. Because our goal is to make it as home environment as possible. So yes, we do everything. We do our barbecue in the summer months. You see this year, you see right now, trust me, if you come here summer months, you won't believe it's the same place you're looking at. You know, with wind that kills your hands, beautiful flowers. But come here summer months, we do barbecue the last Friday of every month. And it's way barbecue. Just like the food in this building. We don't get canned food and all those, we don't do it. From the time Biden Monsignor, the founder of this new community, lived here for 3 years before the Lord called him home. He lived here. And we still have some of the board members of this community who are here as residents. Because, hey, in life, like I said again, things change. And we're going to be here one way or the other. Okay? So, in here, the food is homemade. Yes. We have our residents sit down. They decide the kind of menu they want, and we cook it. So everything is freshly made, and that's important. You have to do the way we do. You're not going to get no steak that is medium rare, because I know we don't eat medium rare, right? We cook our food. So the only way to get it the way we do it is to cook it in-house, so that we cook the way we eat, because we are from this community. I told you our workers have been here more than 30 years. And I told you I've been here way more than 32 years myself. So it's a lot of us. It's home with a lot of us. You don't get that from many of us, but that is here. Then, every summer, in the month of July, we do community cookout, health fair. We bring different companies. We bring all kinds of things so that our community can come out, have fun, get good health education, get some goodies, because they're getting the care that they need. Nobody has crystal ball as to know when anybody's gonna die. Do we? No. But when we do the best we can, the answer is yes, because that's what we believe in. We believe in give it all you got, let God make the decision. Let it to be. Do we have some flaws? Of course, yes. Am I going to stand here and tell you, oh, we are 100% good? Then I'm lying to you. Because nobody is 100%. Is there anybody who's 100%? I don't know about that person. I'm not. But I can tell you one thing. We work with the government. This is one building. People don't know that. It's different from every other building your community has. This building is under the monitor of both the local, the state, and the federal government. All eyes is in nursing homes monitoring what we do to make sure that we do the best we can to provide services to our seniors. So, Ombudsman's office, which oversees the welfare of the seniors who are in an institution like ours, they send an advocate who comes here all the time, see what we're doing, talk to the residents, listen to them if they have any concerns, so that she can bring it to us for us to fix it. Remember I told you we're never perfect, right? But sometimes they might take that second ear to hear it and then bring it to you, and then you take care of it. So please, can you start a minute so that they know who you are? Introduce yourself for me.
Good afternoon. My name is Paul Smith, and I am a volunteer advocate for education.
Okay? So she's here. She listens to the residents in case there's any concerns, and we go from there. So, and again, we have our website. We post information on that website all the time. If you go to newcommunity.org, our communications person, Ms. Mitchell, please raise your hands.
Hello.
I'm sure you must have seen Ms. Mitchell. She updates our website, every information we have, she puts it out there so that you get to know everything about new communities, not just this building, but everything about new community. If we have any health issues to share, we also put it there. We send out monthly newsletters to our families. They see the activities we have for the residents for the month. They see any special arrangements we have for the month is in there. So we make everything as transparent as possible so that people will get to know. You come through our door, you see posters. It will tell you what you need to do and what you don't need to do. In this building, you know other buildings, they stop wearing masks, right? Because they say government is saying stop wearing masks. No, we didn't stop wearing masks here. Why? Look at what is happening today. There is flu outbreak out there. Can you imagine we are not wearing masks here? Most of our seniors will be hospitalized. We also work on vaccination. And I'm going to tell everybody that is sitting in this room, I'm begging you, you are responsible for your own health. It's not the government. You are responsible for your own health. This issue of people being told, oh, vaccination is not good for you, it's not good for you, I need you to rethink it. Can you listen to your doctor, please? Talk to your doctor and listen to the advice of your doctor. They know your health, they will advise you that. Vaccination do save life. Yes, it does. And I see it here. Our residents get vaccinated, hospitalization, dying, they minimize very, very much. So it does save life. And following protocols, using hand sanitizers as you go around the building, you will see us, we maintain these things, take the hand sanitizers, we grab it. Because performing hand hygiene helps kill deaths. Okay? I'm so sorry, I must have taken too much of your time, but I hope you understand. Now there's one issue I need to touch. The issue about money. I need you to hear. There is no nursing home you go to, and I will repeat, there is no nursing home you go to that depending on the insurance you have, that certain aspect of the money has to come to the nursing home. It's not just this nursing home. Many a time people will not tell you the truth of what happened. New Community is a non-profit. That does not mean that when you come to the nursing home, it is free. It's not. Just like every nursing home out there. If you have Medicare, there is the first 20 days, you don't have to pay again. The first 20 days. There is no charge for all the services you're going to get. But after 20 days, from day number 21, you have to pay a portion of your stay. Medicare will still pay a portion up to 100 days, but you have a portion to pay. This is where the issue comes. People say, oh no, it's supposed to be free because this is new community. No, it's not true. New community did not make the rules, it's the government. Now, when you have to stay long time in the nursing home, if you're getting checks, pension, life insurance, whatever money you're getting, the government said, I didn't say, you are not, okay, if I'm saying something wrong, raise your hand and say that's wrong. The government says money follows the person. Which means you cannot keep that money in the community. Sometimes people think I can keep it for my family and I'm here to be taken care of. The government said no. Government says that money will be used to pay for your care in the nursing home, your room and board because they're getting free food, your laundry is being done, your medication, the place you live because now the person live here, right? All that money that you have, government said it will be used to pay for your stay here. And they will give you $50 pocket money every month. Because every other thing is done food. So the $50 is in case you want to buy snacks or whatever, you can use that $50. This is where the problem comes. People now say, oh, new community is taking my money. No, it's not new community. The government said you have to cut that money over. Now, if you have Medicaid, again, it's the same thing. If you have Medicaid, whatever income you are still getting has to come to the nursing home to pay for part of your care here, and the government will pay the rest of it, and you get $50. If you stay and you have to go back to the community, I need you to hear this. You need to go back to the community. Then, let's say we discharge you today, and visit that as an example, right? From March, you get your money back the way you used to get it. Because you are no longer living in the nursing home. So you don't have to pay the nursing home. The government will now start giving you back your money. Did I explain that a little better? Because what happens is many times, people don't understand it. They say, oh, new community want to take my money. No, we don't want you to take your money. The government says money follows the person. So you can't keep the money with your family, with the community, and the government pay for you to stay there. They're not going to do it. So I hope I explained that a little better. Do you have any question for me before I get yes there?
I live in a city here now, really.
Yeah.
If I come in a nursing home, how long can I be, say I need to be in a nursing home like 3 to 4 months? Would I be going back to my house?
If you come and it's a short stay, because 3-4 months is still a short stay.
Yeah.
Yes. Once we have planned that you're going to be going back, yes, your apartment will be maintained full because there is a plan that you're going back. It is only when it has been determined that, and it's not something we do without involving involving the family, involving you, we will all sit down so that you understand why you cannot be able to take care of yourself anymore. That's when, between you and your family, they will now build your apartment. That was a very good question. Yes, sir. I'll come back to you.
In the event that she would be a short stay, would she still be responsible for taking the majority of the income? She still has to maintain her apartment? How would that work?
For a short stay, I'm sorry, hi, how are you? For a short stay, we do not touch the patient income. As long as they going back home, we do not touch. Only if they're gonna stay long-term and staying here, then we'll, it's called a P&A, personal needs account. And that's what we'll do for long-term.
Yeah.
Short stay, we don't touch, no.
Yeah, because you know the person is going back, so that apartment has to be paid for. It will be showing that the money is used to pay for that person's apartment. Yes, sir.
Hello. So does the amount change depending on the age of the patient or the person? So say a person needs to come in for long-term stay and live here. If they receive Social Security and a pension, does the amount that they receive every month change? Or is that the overall same amount no matter how much you receive?
That's a very good question. Unfortunately, the government made the decision of what the seniors would get. That's a problem. And they said it's $50. Yes. Now, what happened to the rest of the money? It can be used to do prepaid burial for that person. So that, you know, the person is alive, paid everything they want. This is how I want my funeral to be, whatever. As long as they use that money for themselves, government is okay with it. But it has to show proof that it was solely used for that person. That's the way it goes.
Is
Yes.
that implemented prior to coming in, or is that something that you guys walk them through on entrance, going forward?
Another good question. What we do is, if the person came and we're now with the family and the patient, we see the person is going to be in long-term care. That means now we're going to apply for Medicaid, because Medicaid is what pays for long-term care in the facilities. For us to do that, they will bring 5-year bank statements. They'll bring their pension, all the incomes, including the life insurance that they have. If there is monetary value for it, they'll bring all that. What will happen is, depending on how much money they have in their account, because for you to qualify for Medicaid, you have to have certain income that is not more than
2009-01 this year.
exactly. It has to be 1900.
2901, they changed the income resource. As long as you're making 2901, you meet the income criteria to apply for Medicaid. It used to be $2,000, but now they increased it because of inflation. So it's 2,901.
Okay, $2,901. You have more than that. So anything more than that, you have to spend it down. And that's what I'm telling you. Many a time, they use it for things that is big, depending on how much money you have, things that are big, like pay for the funeral. We all know, I don't know who has had experience, funeral here, it's not a joke for the family members when the person is gone. It's a lot. It costs so much. So if that person has that money, they use it to take care of that problem so that whenever it is the Lord calls them home, it's already done, the family don't have to stress. And the government is okay with that. Now, if you have a house, this is another one. Sometimes people have a home or a land, and they think the government is not gonna know. The government knows everything. Because we have had that issue here where people bring us what they say they have, and then when we do all the paperwork and send it in, the government said, no, they have this, they have that. We are not going to cover them. If you have a house and you have a husband or a wife that live in that house, I need people to pay attention to this one, that live in that house, The government will now take care of you in the nursing home. However, as long as your spouse lives in that house, the government is not going to tell you to sell the house then. But God forbid something happen. Your spouse does not live in that house anymore. It could be 10 years down the road. Trust and believe, that house must be sold and the government takes the money they have paid so far. And they make the rules.
And let me just, I'm so sorry, let me just say this. If you, okay, the only way the government will not touch your home, if you have a disabled adult or a child, if you own that house and you're an elderly person who needs nursing home placement, the government cannot touch that home because they know that you have a disabled child. So that's one. Go ahead.
Yep. So with that being said, I'm from the geriatrics
Mhm.
in Newark, so I do
Yes.
understand all this. This faces us every day. With that being said, we do know the 5-year plan
Mhm.
that we talk to our patients about. We understand the Medicaid process. Now, there is also the insurance that we make them apply for when they lose all of their cognitive skills.
Mhm.
With that insurance and receiving the pension or social security or both, how does that work? I forget the name of
They,
the insurance. that
are you
they,
talking about the life insurance?
No, it's medical insurance. It's basically when you can't,
Is it like an
Medicaid.
emergency Medicaid?
Yes.
Okay, for emergency Medicaid, they will not cover nursing home. They would only cover the hospital or medical care outside, but not nursing home.
Okay.
Yeah.
Yeah, that's where the problem is. See, the government, in one hand, they give hospitals all the things that they need to give their hospitals. And when it comes to the nursing home, they stand their guard and say, no, we're not gonna do that. And that's not fair, but life is not fair on its own. So many a time people get it confused and say, but when I was in the hospital, they have Medicaid, I have Medicaid, it covered everything. No, hospital Medicaid is not nursing home Medicaid, it's different. I'm glad you brought it up because we have had issues where people think that hospital Medicaid covers them in the nursing home, and it doesn't. Even hospitals will get, what do they call it again, charity care.
Charity care.
And get paid for caring for somebody in the hospital. And when that person comes to the nursing home, no way. No way. So it's actually a big burden. It's a big burden.
And let me just say something about life insurance policy. Life insurance policy count against you when you're applying for Medicaid for a resident. If that life insurance policy have a cash value, there was a face value and there's a cash value. If it has a face value of $5,000 and a cash value of 0, that's okay. But if they have a face value of 5,000 and a cash value of over the 2,000 whatever, that's considered income, resources. So what we usually tell families to do is to open up surrender that life insurance company to a burial fund, because you will not qualify. It has to say no value. If it's less, let's say it's 2,900, you can keep it. But if it's over that amount, you cannot keep it. And that's something that we always trying to explain to families, and they do not understand that we don't make the rules. This is just a government rule.
Yes,
Mhm.
sorry. No, it's good because this is knowledge for everybody, right? You guys know my, do you?
Mhm.
Okay, so with going back to selling your home,
Yes.
we get a lot of patients who ask, because we refer them here, they ask, I understood the statement when you said if your spouse lives in the home, does that count for children? I get disabled children, but in the process of them living there, are they able to sell the home, or are they blocked from selling that home because the government has its hand on it?
No. I mean,
No.
when I said the spouse lives there, husband and wife live together. Now somebody's sick and that person has to go, but the other spouse is still living in the house. The government is not gonna sell your house off your feet just
No.
because your partner is in the hospital. You will live in just know that whenever that house, let's say you decide to sell it tomorrow or whatever, or even the big one, let me say this one too. You had a lawsuit going on. People don't know this. Or you have a lawsuit going on. And you are here on Medicaid. And they award you money. Okay. What people don't know is that that money that you got, the government has handled. Yes, you need to know this, please. Because that money that you got from that lawsuit, and the government is paying for you to be in the nursing home, once that money is awarded, the government wants their share of what I paid for. That's what I was telling you. That's right. Okay? So it's important that people know these little things, because when it starts happening, then they blame us, the nursing home, and say, oh, new community did this. It's not us. We are doing what the government said we must do. I'm sorry, but that's what we're doing. So many a time, when people don't get the true story of what happened, people go out there and they say, oh, new community did this. It's not new community, it's the same thing, all nursing homes. It's not just our home. We are only following the rules. So that's why I felt it's important that, I know I've taken your time and I apologize, but I think it's important that you get to know this one too.
And also the importance of advance directives.
Yes.
You can cover that too. That's very important for our elderly clients.
Yes, I'm glad she mentioned it. A lot of times, we're okay now, we can make decisions, right? You came here on your own, you're able to make decisions. Have you thought about what will happen when you're not able to make decisions? We've had a lot of issues with families, family saga. This family said, oh no, we want this. That family said, no, she told me she wanted this. That one said, this. Now here you are in a limbo. I'm begging you. Now that you are able to make your decisions, I would recommend call your family, sit them down, and say, my people, I want you to know, I want everybody to hear me. These are the decisions I am making. You have decisions about your health. You have decisions about
Good afternoon, the
your
owner
wealth,
of
your
the
property,
store
whatever it is
where
that
you,
you have.
with the license plate Z43K.
You have to make sure
It's parked in the back parking lot.
when you start.
Would you please
And
put
make
in
sure
the
they
first time,
understand
the owner of a
that you are
Toyota
putting
Gray
it
with
in
the license
writing.
plate
And you don't want
Z43KET.
anybody to
Please
reverse
report to the front
it
center.
when you are not able to make decisions. I'm begging you is very, very important. Because sometimes, some families here, they care about you so much, they don't want to let you go when something happens. Let me talk about health fight. But then some people do it out of whatever they think they're going to get out of it. Because then you'll be the one suffering. Am I making sense here? Or they want to get on the other family member's nerves, so now you become the punch back. Push you here, push you down here. Meanwhile, the person is suffering. Health. You know, we never know what tomorrow is going to bring. If you're not able to breathe on your own, do you want it to? If you're not able to eat by your mouth, you want it to. If your heart stops, do you want them to jumpstart it? If you have infection that is gonna just keep you suffering, you want hospitalization in and out of the hospital, they give you all these antibiotics and you just keep going down. It's a decision you're gonna make. Or are you going to say, in an event that my illness or my health has reached to this point where if I do all this, it's not gonna change my life, it's not gonna bring me back and make me better. I don't want all that. Let me go peacefully. What is it right now? You do your own advice. I say, this is what I have. This is what I want. appoint that person as a healthcare proxy, you already told the person what you want. It will make it a lot easier for that person in an event that those things start happening. The person will not make the decision without guilt in their heart because they know that following the instructions you have given them. Am I making sense?
So, after you stated all of that, is it that you will get a power of attorney?
You don't have to have power of attorney to have healthcare process. You just need to be documented that this is who I want to make decision. But now, family dynamics, I have faced that here too. Please, whoever is making that decision, make sure you let your other family members know that you have appointed this particular person. Because I've seen problems with that too, where the issue now becomes, let me go get power of attorney because I am the, whatever it is you are to the person, and there's a talk between what the person wanted when they're alive and what this person wants right now. So do it the right way. Let everybody know, drill it to their ears, this is what I appointed, and have it in writing with your doctor, and let that person have a copy of that paper. When you go to the hospital, they carry you that as well.
And you have to do it while you are alert and oriented.
Yes.
If you cannot talk,
Make that decision.
it's not gonna be done. Okay, so you have to make it while you are alert, oriented. You have your full knowledge, full thoughts. Okay, go ahead.
It's not a question, I just wanted to piggyback off of
Jill.
question. This is a form we give out every day, we talk about this form every day, just so everybody is aware. A proxy is a medical form, that is only for medical reasons.
Reasons. Mm-hmm.
Remember I told you there are two parts, right? I said the health part, and now we're going to go to the financial and property and all that good stuff. Now, when it comes to your wealth, because that's the way I'm going to play. The money, the house, whatever I have to do with that. Now, that has nothing to do with your health care. You can choose this person to be your healthcare proxy. And you can choose that person to manage your wealth and deal with whatever, how you want it. The two are two different things. I have had somebody brought a paper that has to do with their wealth and everything, and I told them, no, that doesn't work here. Oh, but that's the paper they gave me. I said, I'm sorry. That's for you to manage the finance. This one here is a different kind of paper, and that's what I need. Because you see, when that don't happen, now your family starts going to court to go get power of attorney, which is not a 1, 2, 3 thing, yeah?
Or guardianship.
I know that. It's not, or guardianship.
Mm-hmm.
It's not easy to get because it requires some steps, going to court, all that good stuff. Why subject people to that if you can take care of things now that you can talk and make decisions? It puts us in limbo, healthcare workers, because you don't want another drama when the family starts. And then it puts you on push around you yourself when you're not well. You really don't want that. So these are decisions that you have to make. And then you try and do it. It's important. Any other question before I call some people to come talk to you? I've talked too much, right? I'm sorry.
I'm sorry. We're gonna eat. Don't worry. After Miss Anne Marie finish talking, we're gonna have some
No, we're gonna
food.
make it quick.
Yeah.
I'm already talked
Mhm.
to you because I've covered most of
Yeah. She won't take long. After she's done, we'll have our food, drinks. Okay.
Services is here.
Okay.
I
Yes.
need them to
Yes.
have a
Mhm.
few words too,
Sure.
And NCCTR.
Yes.
So, go ahead, Anne
Good afternoon.
I promise I won't stop between your food.
Good afternoon. So my name is Anna Marie. I'm a nurse practitioner. We're mid-level providers. Basically, we can do everything a primary care physician can do. I can see patients, assess patients, order tests, order medications. I'm part of Optum, a long-term care program under United Healthcare. It's a managed program that participates in this building and other facilities. meeting 3 times a week. So I have a pod, which is myself, registered nurse and RN who comes on the days I'm not here. And I have an administrative assistant who comes in and does paperwork, helps me with getting appointments for patients, tests, schedule, that sort of thing. So it is a pod. On the days I'm not here, my RN is here, or vice versa, we alternate based on acuity. So, the other thing our program does is to reach out to families. Any patient enrolled in our program, we pick up the phone, we update them once a month on how their loved one is doing. If you notice any changes, they have my direct cell phone number, so they can reach me during business hours. If one of our patients are sick and we come up with a plan to treat the patient in place, I do sign up my patients to an on-call service that's run through Optum. And what they do is call the facility 3 to 11, 11 to 7, 24 hours a day to check on our patients, to see if there's a change and something else we need to do for our patients. So it provides an extra layer of support to the patients here, and the goal is to provide the right care at the right time. So it is a service that some of our patients do use. The doctors work very well with me, because I am here, and sometimes we can pick up things right away. Like if you notice a change in confusion, if you notice the patient is not doing what she normally does, because I know where my patient is when I walk in the building. If it's 12 o'clock and they're still in bed, I know there's something wrong with my patient. So I will go assess it. So it's just an extra layer of care for our members. And, if you have questions, if you want to know if your loved one qualifies, you just have to reach out to the admissions or the business office, and they'll be able to see if your loved one qualifies for the program.
Thank you. Thank you.
So let me call NCCTI to come in and tell you guys a little bit about their services.
Good afternoon, everybody. My name is Miguel Pacheco, and I am the director of the Community Career and Technical Institute. It's located right across the street. What we do there is we offer a variety of different services that focuses on short-term careers. Currently, we're focusing on clinical certified medical assistant. We have a patient care technician program. We also have an automotive technology training program. These programs are focused about 5-6 months long. With the exception, the automotive program is about a year long, and the goal is to learn skills and prepare you for a potential high-paying career. We serve many different kinds of students, some who are coming out of high school, those who are transitioning from careers, and those who have been out of school for some time and want to come back. Again, our program length varies depending on the model that the program that you're looking for. Mostly 5-6 months to about a year, and we're located right across the street. Our automotive program is located in an office 210 West Bigelow here in Newark as well. Again, we are Community Career Technical Institute, NCCTI. You can find us on the community website, and just another service that we offer here at the community. I'm happy to answer any other questions, but thank you so much for finding us.
You're welcome there. Jackie, you want to read about the program? And after Jackie, one more, I promise, that's it.
Good afternoon, everyone. My name is Dr. Jackie Andrews. I run several programs here in the community, but one of the programs that I run is the Home Friend Program, and that's for seniors 60 and up. And what the Home Friend worker does, she goes into the home, and she helps with light house duties. Maybe the laundry, fixing the kitchen, and so she worked and being a companion to the senior. So that, along with the extended care, is one of the great services we offer here in the community. I just have one story right quick. My mother was here in the extended care back in 2016, and she received excellent service here while she was here, and it was so convenient for me because I'm located next door as well. So I was here every day to be here for her. So the extended care is a great place for your loved ones. Thank you, my dear.
Thank you. And you're having an event coming up the food bank, the food with the food bank. Yes, please talk about that.
May 20th, that's a Tuesday, from 11 to 2, I believe it is. We're having an event on Youth Street. The event title is United for Food Security. I'm sure all of you know that there is a crisis on food. You know, we go to buy groceries, everything's so high, you know, like $5 you can over $100. So it's a global crisis. So we want to bring awareness to the community of that, you know, it is a food insecurity. And we're gonna have other agencies there, you know, we're gonna give out food, we have dancing, music. So it's gonna be a great event, so please share.
Yeah, tell people in the community to come because they need to. Whatever we can do to help our community, please.
And the last is Karen, the director of Youth Community Harmony Health. I run the homeless family shelter next door. Provide short-term homeless services to homeless families and at-risk families with children. And it can anywhere from a day or two up to a year.
Thank you so much.
All right, everyone, it brings me to the final say before we leave so that we can go visit the building and see the attendees we have. New community, like I said, the motto, the mission of the senior women's movement. The white man who came to the black community and made himself one of us. I have to tell you something about that man. He is a saint. And I know when I say he's a saint, he's really a saint. He would have been a very rich man that should have nothing to do with none of us. But he believes so much in this community. And new communities like United Nations, by the way, every tribe you can think about is a part of it. His mission and vision is what? To have residents of inner cities improve the quality of their lives, to maintain their individual God-given dignity and personal achievement. See, it's those kind of mission, those kind of things that keep majority of us here. Because it's a mission and a vision that we should all embrace. That is why new community has every service on the take about. You see inside this building, there is a bank. We have the ATM machine right here. So that the staff, the residents, they don't have to go outside and somebody gets robbed because they're trying to get their money. We also have ATM machine even in the healthcare building across. We have childcare services. We have technical school that train people for trades and everything else you can imagine. We used to have Batman. Yes, right here. That Batman used to belong to this community. We used to have Sawyer Center. That man had a vision that everything you needed was inside new community. That you don't have to go outside to go look for it. And I'm asking each and every one of you sitting here to please, I'm begging you, let us work together. Let us hold on to what this man has handed over to us. You know, before he died, you know what he said to me? He said, where do you put poor people when they die, when they have nothing? I said, oh, I have agreement with Perry Funeral Home. And I use them for our residents that might not have any money. I didn't know why he asked me that question. I didn't know. Before he died, he said, I want you to take it to Perry Funeral Home. Where he was the first white man that actually dressed at Perry Funeral Home. They didn't even know how to do his makeup because it was new for them. But the whole father of the entire new community nursing home and died here after 3 years. Are we going to let that dream die? We shouldn't. Because if somebody of that caliber can sacrifice for us, it's up to us to get that light money and don't let it die. So I ask you, pass the message on to those who are not here. Let them know. There is a lot, this is the only nursing home that has a chapel. And this chapel was approved by the Pope himself in Rome. From the day the foundation was laid, the foundation was blessed by the cardinal, the Catholic cardinal. And when it was completed, it was opened by the cardinal. This is the only nursing home that has a priest assigned to it. And it's very religious. I want you to know we do our prayers. And it's important to us. And the chapel is not only for Catholics, by the way. Different religions that come here and they use the chapel. The chapel is an open chapel for all religions. It's a place of worship. It's not just for Catholics. I want you to know that. Because if somebody is a Muslim, they want to go in there and pray, no problem. And we have different churches that also come and they utilize the chapel for their services. So a lot is into the community and people care. My admissions person, I couldn't have asked for a better human being than this young lady. She will go to her sleep, yes,
Thank you. Thank you.
She will go to her sleep and mop the floor because that's what we do. We don't say this is my job and that is my job, no. It is our job and we all work together.